Okay. All right. So what we're going to do today, class? Let me do this. Okay. Can you hear me? Okay. Okay. So what we're going to do today is we will spend most of time today talking about a very common condition called atopic dermatitis. This is the one that we spoke last time, right? But today I'd like you to come up here and talk to us in a different way. Okay, so we will become your patients, and but this time we will ask you a lot of challenging questions. I just tell you ahead that so me, Dr. Doc or Sarah, I tell you about the disease first, so everyone know this atopic dermatitis. But when you come here, I'll be your patient. I'll be the daddy or a mother or whatever. But it's going to be a difficult parents. Are you ready? All right, come up here. Who is the first one? All right.
Right, okay. Ready?
Hey, good morning, doctor.
Hi there.
Hey, my name is Win. I'm here because of my son. He has a lot of rash, but he's not here today. So I'd like to ask you, what should I do for his rash?
Okay. Why did he's not here? Why is he not here today?
Oh, why?
Why?
Because he doesn't like doctor.
Okay. So how old is he?
I have 2 years old son.
2 years old. And where is the rash?
Oh, he has rash both hand and also on his face, both face.
Okay.
Hand, face, yes.
Yes. And how about the other parts of the body? Legs or no?
Yes, he has rash on hands, legs, thighs, and some of his chest too.
Okay. And is it red?
Yes, it's red.
Is it itchy?
Oh my gosh, it's very edgy. I mean, my son's crying all night.
How long have you seen the rash of your son?
Since he was born, it's going away, and now it's recurrent.
And when is it worse?
Well, it's usually in the winter time.
Winter time. And is it worse after you take bath for him?
Oh yes, yes, absolutely. It's really.
And what did you do to make the rash better?
Okay, so here's the thing. Someone from Facebook told me to buy a cream, and I don't know what it is. So I applied to his skin, and initially I think it looks better, but today it looks really bad. So I'm concerning. I like to bring him to see you today, but he doesn't want to see doctor. He crying, so that's why I like to see you first to see what else you can help me with.
Actually, you should bring him to me, but
Okay.
But he's absent today, so I try to help you.
Okay. So what should I do? Should bring him here, but meanwhile, what should I do now?
Okay. Let me ask some more questions.
Okay.
Do you have a members in your family have a rash like this, like him?
Oh, I think his sister also has that. Yes, I think I have another daughter, and also my daughter has that too.
At the same age, when she's at the same age or now?
Yes, when she was about 2 or 3 years old. Yes.
Okay. Mm. Does he have any special diet?
Diet? No, but that's my question too. Now, does it matter? I mean, in terms of diet wise, will it make an impact to my son?
So I'll ask you some question about the rash.
Okay.
Is it have a blutter?
You mean vesicle, right?
Color, yes.
Okay. Some of them, yep, it has some vesicle, it's ruptured, yes.
Does it have a yellow fluid inside?
Sometimes, yeah, I see a little bit. Yes.
And after he scratching, do it have the crust? You know crust after scratching?
Yes, you mean scratching, right? Okay. Okay, yes, he does have some scratch marks, yes. We also call excoriations. That's the terminology. Excoriations. Okay.
Does he get fevers or have any signs?
No, no fever, but I don't think he's doing well. So in terms of diet, what should I give my son?
Diet?
Yeah, diet.
I'm not sure if you have a normal diet. I think you should keep it. You should continue to feed him with a normal diet.
Okay. So you mean hamburger? It's okay. Yeah, French fries, everything's okay. Whatever he like to eat is okay, right?
I think so. After asking you some questions,
Okay.
it seems like your son have symptoms of atopic dermatitis. You know
Okay.
that disease?
Is it contagious?
Yes.
Wow, it's contagious.
Um, no, it's not contagious.
Oh my God, thanks God. Because I have one too, so I thought I got it from my son. Okay.
Okay. And just so keep the lesion clean
Uh-huh.
and you should soap
Mm-hmm.
it every day, and maybe I will give you some kind of moisturizing creams to make it.
Okay. Sure. Okay. By the way, you know, so I don't know what it's called on Facebook. It's called Kem Dome. Is it good for my son?
Okay. It's kind of a cream that they mix many things together, but it doesn't have a kind of exact origin.
Oh, really? So what is Kem Dome?
Maybe they have some traditional know-how, traditional know-how. So I don't know what it is, so I don't recommend you to use it because
Okay.
maybe it have a things that harm to your son.
All right. All right. All right. Thank you, doctor. And I will bring my son to you next time. Thank you.
Okay.
All right. All right. Time's up. So I let Dr. Doe and Sarah give feedback about this. It's more like a soft consultations when you talk to parents. So I let Dr. Doe and Sarah comments.
Yeah, so I think let me start first then. I think it's I think it's better than last time. Last time actually I don't have a lot of time to listen to the whole conversation. I just pop in and out, and I'm sorry for that. But seem like you once you stay focused on one conditions, you know about what to ask, then you prepare for that, and the conversation goes on much better than last time when you have to try to figure out what to do, what question to ask, and also at the same time you try to guess what the disease the patient have, even though that we don't have to focus too much on that. So right now, yeah, mentally you feel better, so you prepare for that, and so that things works come out much more easier and more fluent. Yeah, so the second things, I think you do better this time, but I think I believe that you can do even better. That's try to show some more empathy, to show that you care for the patients. And yeah, it seems like that you you just a little bit off initially, but yeah, I think it's going to be better with time. And the one more thing I tried to say, but I think my memory deserts me right now. I forget. Yeah, at least that's one thing. Yeah, because about all the creams or all those things that you're not sure. Actually, there's a lot of things out there that we don't know, and I think you take the right approach that you say directly that you don't know. I don't want you to pretend that you know and give advice that totally not right. So yeah, over here we have patients and bring herbal medication from their own country, and I just tell them honestly that yeah, I'm studying Western medicine. Those things I totally have no idea. It may work, it may not. I have no clues. If you have a good doctor practicing that traditional medicine, then maybe. But for now, yeah, I don't know how it's interact with the medication I give you. So yeah, I suggest that yeah, not using that. So just be honest, be frank, and yeah, be direct, so that patient can trust you, trust your judgment better. Yeah, but overall, I think it's much better than last time for sure.
Any comments, Sarah?
Yeah, I have the same opinion as the Anman. Just a few things that I think you. Sorry about the noise. You a little bit hesitate when the patient didn't bring his son with him. I think it's quite normal. It's the first time you have to like actually deal with like that kind of situation, but you can try to be a little bit like nicer and like request them to bring his son in like in a nicer ways. It could be easier. Okay, I think that's it.
All right. So as you see, if you prepare, you will come to this class and you're doing okay. So that's the intention. All right. Who's the next one? So let's try and make a habit that we do a quick and then keep moving and keep moving. Okay. Now it's your choice. You can pick me as your patient, or Dr. Mindo, or Sarah as your patient. What would you pick? Hello? Hello? Yes, good morning. So who would you like to be your patient? Speak louder. Me, Dr. Do, or Sarah. Be confident, speak louder, smile. Okay? Who?
You.
Okay, all right. That's fine. I'll consider patient. All right, so this is a situation. I'm a 16 years old gentleman who have acne. Okay, so 16 gentlemen who have acne, and this is my first time to see you, and my face have a lot of acne. All right, are you ready?
Yeah.
Oh, doctor, it's so horrible.
Why?
My girlfriend, she just left me.
Okay. What can I do for you today?
Well, I hope you can fix my face.
Okay. You have acne?
I don't know. People told me that I have acne. It looks like I have acne.
When? Okay. When did it start?
It actually started about 3 or 4 years ago.
3 or 4 years ago?
Yes.
Just on your face? Anywhere else?
Some on my back too, but I just kept on my face. You know, nobody look at my back, but my face.
Okay. And it's come. The acne comes and go.
Really, it's been there all the time. I don't see it going. I think it's just getting worse.
Okay. And have you taken any medicine yet? Or
Oh, I try a lot. I try all of them. I try all of them. Trust me, I try all of them, doctor. I try, you know, going. I try whatever they told me on Facebook. I try all of them. It did not work. Okay.
just cream, or you take medicine, oral medication?
Yeah. I took medication too. Yeah.
Can you tell me what's the name of the medication?
I don't remember. I mean, it's well, I don't know. Somebody told me, somebody give me something, I use it, and so I try everything.
You try steroid and antibiotic, right?
Antibiotic. What the heck is that? Why you think I have infections? Antibiotics infections? So you think I have infections? I have skin infections?
Yes, right.
But acne is not infection, right?
And what did it look like? What your acne look like at the first time? It's the same. It's the same this time.
Well, at first I just saw some, you know, some pimples, some red papules on my face, and then it become pustular. There's pot coming out. It rupture, and you know what? I hate it, so I crushed them out. Okay, and now it's scar all over my face.
Okay. Well, and you scratch and you rub or squeeze all time on your face.
Yeah, I squeeze them all the time. It's actually I squeeze them a lot. Yes.
Did they ask them to infect it the acne?
What do you mean?
Your habit lead to infect it the
Oh,
acne.
okay. So my habit, you mean the squeezing can cause infection. Oh, I didn't know that because I think I saw it coming out. You know, I saw pus coming out. Like I don't know. Okay.
And how about your menstrual cycle?
Oh, I'm a man. I don't have menstrual cycle.
Okay, sorry. And have you suffered from any internal disease?
Internal disease. What is internal disease?
Okay, illness, internal illness.
Internal. Okay, secret. Okay. You mean do I have any medical issue, medical problems?
Yes, sir. Yes.
Okay. Well, I'm just a little bit overweight. People told me that I'm overweight, but I don't know. I think I'm okay. You know, I'm not that big. My BMI is about 40. You know, it's not a lot.
Are you under pressure?
Am I under pressure?
Yes.
No, not really. I just hate that my girlfriend, she left me. I don't know why she left me. No, she told me that my face it's not like, I don't know. I just hate myself. Okay, I be honest with you. I'm very depressed. You know, I don't like it.
Okay. And have you had any symptoms besides your acne?
No, I just don't eat a lot. I sleep a lot, and I feel like, I mean, my face is make my, whenever I go out with my friends, you know, they always selfies. I take a picture. I used to do that when I was a kid, but now I cannot do it anymore because my face, it doesn't look good.
You can use you 360 degree.
What?
Never mind.
Okay. So what should I do, doctor? I'm very depressed. I'm willing to do anything that you tell me.
Okay, you know, you had acne for a long time, and you had pustules
Mm-hmm.
and scarring
Yes.
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 all over your face. So
Mm-hmm.
Your acne is severe,
Mm-hmm.
moderate to severe.
Okay.
I think besides use cream to apply your face, you should use oral medicine. And now I will
What
I
is
will
oral medicine? What is oral medicine?
um, I will write out the prescription antibiotic. Okay, and I give you some cream, moisturizer to keep your face not avoid dryness and skin peeling.
Okay.
And you should remember and and break the habit of squeezing your acne. It may be infected your acne.
Okay.
Keep your face clean. Wash your face twice a day,
Okay.
not more often.
Well, you know, it's washing a face twice a day. To me, it's very difficult.
Okay,
I rarely take shower. You know, I take shower every couple of days.
couple days. Okay.
So you ask me wash my face twice a day. It's a lot.
A lot.
How many times you wash your face?
Two.
No, I'm asking you, doctor. How many times you wash your face a day?
Twice a day after you wake up and before you go to bed.
No, I'm asking you. You wash your face 2 times a day too?
Me too. Yeah.
Okay.
After I wake up.
Okay. All right. I try, doctor.
You look at my face. I have no acne.
Okay. Wow. Can my face look like your face?
Yeah. Maybe if you
Okay.
follow my advice.
Okay. Okay. Oh, that makes me some hope. Okay.
Yeah.
Okay.
And,
All right.
Any question else?
No, I just want to lose my weight. You know, I feel I'm a little bit heavy. So now people told me that if I have acne and I have heavy weight, does heavy weight make my acne worsening?
Weight, high weight make acne?
Mm-hmm.
I don't think so.
You don't think so? Okay. Right.
Maybe you eat fast food and hot food. It makes increase acne.
Mm-hmm.
It makes more acne than normal. So
Okay.
you avoid the fast food and hot food.
Okay.
Will be better.
All right. So let's stop right there. So what do you think? Do you feel so that better? What you guys think in general? What is your communication? How you interact with the patient?
Yes, I'm confident. I'm more confident.
Okay. Well, So this time I like to let Dr. Doe or Sarah give feedback, because the way that I think it's better to let someone observe your behavior, your speaking, and give feedback.
Go ahead, Sarah. I'll let you do first.
Okay, so just a few observations. So first, when he tell you that his girlfriend just left him, I would expect a little bit more compassion toward him. So like, I'm sorry to hear that, or something like that. It's not just like, okay, it sounds very like you are ignoring his emotion. So just try to be a little bit more compassionate toward him. And there's a few pronunciation that is not quite on point, like scarring, not scaring. Scare is like afraid of something, is scarring. So, and I couldn't think of it. And yeah, and when he's when you talk to a patient, try to think of like how his emotional state at during the conversation, because like, as I see, like at the middle of the conversation, the patient start mentioning he's feeling depressed. So you should address that as well, not just the like the problem the patient come to you with, but also his emotional state, because like depression can also worsen his symptoms. So if we can try to do something about that, maybe he get better too. So yeah, that's my observation.
All right. Yes, go ahead.
Yeah, just some little input. Yeah, it is seem like Dr. Trunk maybe make you a little bit off guard. He's present himself as a young gentleman and already in the situation. The girlfriend's leaving him. He's feel depressed. He's overweight. He tries many things, but it's not working. So he's presents to you as a challenge case. So yeah, that may throw you off a little bit. Instead of present as a nice young handsome man looking for treatment and willing to do everything the doctor say. So yeah, those patients who ask a lot and who only did something and have some question about the judgment of the doctor, sometimes it may annoy the doctor a little bit and maybe make you feel a little bit uncomfortable to deal with. So yeah, it's normal, but be a professional and pay attention to the patient, the feeling, rather than what he present to you. Normally, no one come to see the doctor just to try to annoy the doctor. So yeah, that's what I think you may try to improve on. The others is try to improve a little bit on your English. Like Sarah says, some pronunciation is not correct. You may still think about what to ask rather than have it come out naturally. So that's why you lose track of the case and ask if he had period or not. Which is you forget that he's present as a young gentleman, not a lady. So yeah, try to have the whole set of questions ready for you, so it's come out naturally, so that you can easier build a case and understand the situation, rather than try to remember every question and try to compose each question on the spot. It's much more difficult for you. Yeah. So, but yeah, I think you're doing better. Keep practicing.
Yeah, I'm second to all the comments, but just one thing I like to remind you guys, acne, and you look for a bigger picture. This is a gentleman who overweight, BMI 40. This is a really big guy. For you guys, all the class right there, I guess your BMI is about 18 or 17. I mean, in Vietnamese, a little bit, you consider mập rồi. BMI 40, it's huge, like huge. BMI 40, roughly maybe about 200 kilograms, 220 kilograms. So about 3 of you or 4 of you, it's really big. If you have a big gentleman like that, you don't treat just acne. You should ask more about at least metabolic syndrome. You heard about that? Okay, so risk of diabetes. Okay, risk of hypercholesteremia, cardiovascular disease, even though he's 16 years old. And then the other one is you want to check the whole body. You want to rule out inverse acne. Have you heard about that disease? So the acne that you saw in your face, or usually it's just the outside. But there's a condition called inverse acne or superhidrota. So those conditions can happen in severely obese people. So you want to make sure that. And then lastly, communication. I think it's improvement, but the way that I say it's for the entire class. So when you see a patient, try to not to keep monotone or keep short sentence, because this is I understand when you speak a different language from different culture, but try to make it like if you pay attention to Dr. Min or Sarah, the way that they speak, they all up and down, or they're not singing, but you see they can go up and down, and that makes you awake, right? Can you imagine if I'm talking to you like this? Can you imagine if I'm talking to you at the same tone? Like it's very boring, and it's so not everyone, but when we talk to patients, we try to improve that. But I see some improvement. Okay, thank you. Comments? Okay.
Also, I just also suggest so that in order for the rest of the group to pay more attention, we may ask you to pick some of you to give feedback also, so that you be more engaged in the conversations, and you learn from other mistake as a judge. I think that's also the good way to learn. So be ready. We can ask any of you to give feedback before we give feedback. Okay, so make it more interesting learning activities.
So who's the next one? Good. All right. So this time, why don't you pick Dr. Do and Dr. Jin, Sarah Jin. Okay, go ahead.
I want is them Sarah Chai.
Okay, sure. Oh, so you want Sarah child? Okay, so Sarah already have a kid. Okay, good. I don't even know that.
Okay, sure.
Good morning, madam.
Morning.
How can I help you?
I think my child has lupus.
Oh, how old is he?
He's 4 months old.
4 months. 4 months.
Sorry?
When it start?
You mean the lupus? I think it's like 2 weeks ago.
2 weeks ago. And where it start?
It's on his face. So basically 2 weeks ago, I saw that he has a weird rash on his face, and then I Google it, and they said on Facebook that he has lupus.
Lupus.
Yes, that's what I Google.
And the rash appear where this the rash appear other.
You mean did the rash like appear other place? Is that what you mean?
Beside her face, the rat where the rat appear,
Just the face.
just the face. Uh, did you use any medication or cream before the rat started?
Before, no.
Yes. And in your family, have have you tried any skin product recently?
So I have an aunt who has lupus. She has the exact same rash. So that's why I think my son have lupus.
Yeah. Is it itchy?
I'm not sure. It seemed bothering him, but I'm not sure if it's itchy or it's painful or he's 4, so I couldn't really tell.
Uh, you see this see correct her face, correct her face.
I don't know, like it just seemed bothering him, so he keep touching his face, but I don't know, like is it like hurting him or is it like itchy for him?
Yeah. Um, was the fever when it start?
Mm, I didn't measure his temperature, so I don't know.
Yeah. Um, uh, what make it worse?
Going out to the sun after the shower.
Uh, after after shower and
Mm-hmm.
the sun.
Mm-hmm. Mm-hmm.
And what make it better?
So I borrowed some like cream from my aunt. I think it's steroid. It put it on. It seemed help a little bit.
Yeah. Um, and this the rust come and go.
Mm-hmm. Yeah, it comes and go, but like I don't know, it faded a little bit, but then it came back.
Yeah. In your family, are there anyone uh, appears the same rust?
So not at the same time with him, but as I told you, my aunt have lupus and she has the exact same rash, but not at the same time with him.
Yeah. And is he allergic to anything?
I don't know.
Yeah. Um, what are other side? Uh, what other side?
What do you mean other side?
Beside the rat, what other side is it?
I didn't notice any other problem, just the rash.
Yeah. Now I re-summarize uh, her, her trouble. Um, your
Okay.
your your son, your son,
Sun.
your
Yes.
son is 4 months 4 months old. He's yeah, the rust on his face. You don't know he is she or not. Um, not you're not sure allergy allergy or not. Uh,
Yeah,
it,
because he's only 4 months old. He hasn't eat anything yet, so I don't really know if he allergic to anything. He just drink milk.
yeah. Um, and he's not fever. Uh,
No fever. None that I know of.
And he's still he's still feeling good.
Less than usual a little bit, but yes, he's still drinking his milk, so it's not too bad.
Yeah. I think he has a atopic dermatitis, not lupus.
What is that?
It's also named eczema.
What is eczema?
Milk eczema. Milk eczema. Um,
Okay, so is it like dangerous? Is he dying?
no, it's not dangerous. Uh, uh, it's just a common disease. Uh, mm, Often has at children uh, uh, children, and it can prevent and
Yeah. Continue. I just need to charge my.
it's a common disease, and it can treatment. I will have you some advice for advice to prevent prevent it worse.
So is it curable?
Uh, yes, but sometimes it can come back.
Okay. Okay. Thank you, doctor.
Uh, what uh, uh, what other question?
No, I think I'm good for now. I'll try your treatment and then we'll see.
Yeah.
Okay, thanks. Okay. Anh Minh có feedback.
Yes. Okay. So as I mentioned earlier, let's pick someone from your friends to give feedback. You would like to ask any of your friends to give feedback for you? Just pick one, whoever you feel you can trust his or her opinion. Just pick one of your friends to give you feedback.
Okay, someone you hate in this class.
I don't want any of your friends hate me, so I let you pick. Bạn muốn ai cho bạn feedback, phản hồi thì bạn chọn một người nào bạn thấy tin tưởng, giỏi giang hay là đẹp trai đẹp gái nhất các bạn chỉ.
Just one.
Yeah, just one. Any of your friends. Just turn around and see who is the most beautiful or the most handsome and pick him or her.
I want Dr. Mendo.
No, this is your friend. Turn around. Pick your friend. I will, but later on.
On my friend, yeah.
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 Oh.
I think that she has a cover on the outcome. The question.
I think you may come closer. It's difficult to hear your voice. Or maybe you're gonna be the next one also. So yeah.
Okay. I think,
Yes.
Dr. Ang has used the outcome to ask the mother's patient. And I think the patient is 4 months old he should ask about the breastfeeding or not. And Sarah always wonders about the lupus because of the arm. So he should use some evidence or something to rule out or to say that is not the lupus or something like that. And about the conversation, I think it's okay.
All right. So let me jump in. So what is the diagnosis for lupus? No, I'm serious. Does anyone know the criteria to diagnose lupus?
It's not start too early like that. Maybe the skin will start after 6 or teenager or some age older than this age. Because and it describes about the lesions. It has the butterfly image in the face.
Okay. So you talk about skin rash and you talk about age. What else?
Sorry, I'm not sure about this disease, so I cannot tell
more. So the common thing is in real life, we would not or we don't know a lot about diseases, especially if this is not your specialty. It's completely okay, right? For example, I will not much about how to remove a brain tumor. I don't know how to do that. So when we confront with a disease or a condition that we don't know, it's completely okay to say, well, I'm not sure, but I will refer you to a specialist. I will refer you to a pediatric rheumatologist if this is your concern. So I'd rather say that than say this is yes or no, because the moment you say no, there's two things. First of all, we don't have the diagnosis. This is based on, and secondly, if the patient have lupus, if the patient indeed have lupus, and I tell you, at least in my or in my specialty. By the way, I'm a rheumatologist, so this is how I see that too. We see kids have lupus, and they can have lupus at a young age. So if you say people don't have lupus, and indeed they have lupus, you know what happened? They're gonna sue you. It's just simple like that. It's sooner or later this country on Vietnam. So just be mindful when the condition that we don't know. So that's why I say, oh, I don't know what it is, but I refer you to a specialist. Does it make sense? So that's how I do it, and try to collaborate. And here we focus on communication. So like I say, we focus on how you talk to patient, how you reassure, or if you don't know the answer, which is fine, but how to say that. Just say, oh, I don't know. Just say, I don't know, or I don't know what it is, but I will have somebody look at that. Okay, so that's my comment when I confront, or if I don't know about a condition or something, I'm not sure, I will refer to someone know how to do that, or something you can say, let's investigate further. Okay, let me ask you more questions before I think this is not lupus. All right. So thank you. And so why don't you, the next one's coming up, and I will tell you this time we will pick, because it sounds like all of you like each other. You don't hate each other. That's good. So when I asked you to pick someone you hate, you did not pick anyone. So this is a really good bonding group. I know that. Okay, so I'm going to break your bond. Okay, I'll pick some of you, and I will ask that person critique your performance. All right, ready? Next one. Okay, we don't have much time, and so that's why I keep going. So the person who come here also learn, but also the person critique also learn. So that's the two-way street. Okay. So who is the next victim?
Hello.
All right. So now let's let you and Dr. Mindel pair. Okay. So in this case, let's Dr. Mindel. I don't know if you want to tell. Okay. So I just leave like that and let Dr. go ahead.
Okay, doctor, help me. My child, he has a bad fever.
Oh, yes. Bad fever.
Yes, he's right here. He's hot. You can touch him. He's like burning hot.
Hmm.
Mm, when the fever, when did the fever start?
I'm not sure, doctor. I just came back from work and my wife said that he's not playing and now he's so hot. Maybe sometime in today morning, maybe. I'm not sure.
Mm. And the fever, did the fever last on time or come and go away and come back?
I'm not sure, doctor. I just came home, but yeah, maybe it's own day. Since my wife said that he's not playing. He just stay in bed and crying.
Hmm. Um, have he had any symptoms?
I don't know. He's right here. He just seems like he's sleeping. He's have running nose. You can see. Yeah, and he's not playing. He's not himself at all.
Hmm. Mm, have he have a cough?
Yeah, yesterday seemed like he coughed a little bit, but he was still playing. Yes, last night we just came back from Mexico. Uh, we was there visiting his grandpa, and yeah, we spent 2 weeks over there. He's very healthy. He's very good, but now he's here and he's sick. I don't know why.
Okay, just calm down. Um, mm, have he had taken medication?
No, doctor. He's take no medications. Yeah, I don't believe in Western medicines. He's not taking any medicine at all. Never, ever.
Mm, did he eat did he eat and drink fewer than normal? Normal?
Sorry, can you say that again, doctor?
Did he eating and drinking fewer than normal?
I'm not.
Normal.
I'm not sure I understand you, doctor. But since I'm home, he seems like he doesn't want to eat or drink anything. He's just sleeping and yeah, have the bad fever.
Okay. Have he had exposed anyone have this condition like him?
Oh, now that you mentioned, doctor, when we was in Mexico, I think the kids, the neighbor had the kids. He's looked pretty sick. The last day when we left, but yeah, but I'm not sure. That kid looked sick, but he was playing before until the very last day. I don't know. You think that kid may give my kids what he has?
Okay. Oh. Hmm. Have he had a seizure?
No, I don't know. I forget to ask my wife, but so far no seizure. Thanks God. You think he may have a seizure, doctor?
Oh, I just want to know the history of the sister of him. I don't know exactly the diagnosis now, but I just want to the history to in order to prevent the seizure.
Okay. Yeah, he's just yeah, so hot and look like his face is red. And yeah, I don't know. Can you check on his face? Seems like there's some pimple or some rash, something like that on his face. It's not there. It's not there yesterday. I don't think it's there yesterday.
Okay. Oh. Now I will examine him, and after that explain the present unit of him to you. Okay.
Okay, doctor. What you want to see on him, doctor? You want to check his whole body? Or what you want to check?
Check the body and maybe check blood of him to do some tests.
Okay. Oh, you want to draw blood from him? Oh, you really need to draw blood from him, doctor?
Okay, maybe I'm not sure.
Okay. Okay. You think he has something serious, doctor?
Maybe. Just come down. I'm here. I'm here to help you. Okay.
Okay. You think he may die, doctor? He's not talking to me. He's used to be a very lively kid.
No. Just come down. I don't want. I don't mention that.
Okay. I trust you, doctor. I trust you, doctor. Please help my child.
Okay. Let me.
Okay. We stop right there. And so, okay. So the few things I would like to say, but I let you pick the one you hate first, or just like Dr. Trung said, who you hate the most among your friends. Pick one to give you the feedback. See if he or she pay attention to your presentation or not. Which one you want to pick? Pick the one that you truly hate.
I'm very sad.
No.
The most.
Okay.
Okay, I think she asked so many questions efficiently, and she followed the old course very well, and maybe the fevers is kind of I mean it's systematic symptoms, so many symptoms, so it makes her kind of confused to ask questions, but overall I think it's good.
Okay. Any question you think you may ask if you are in her place? Any question you may think that she may forget to ask?
I'm confused too, so I don't know. Question.
Do you know how old the child?
How old?
Oh, you never asked. She never asked about the child's age.
I think yeah.
Yeah. You know about his vaccinations?
Okay.
Yeah, I purposely tell you that we don't believe in Western medicines. He's not taking any medications, and he's afraid of even drawing blood from the kids. So yeah, I think it could be a routine questions, but yeah, don't forget about the vaccination, especially that I said that we visit Mexico. It's next to the US, but it's also several areas over there. They're very poor also, and no vaccination. The healthcare is pretty bad over there in certain area. So yeah, very likely that the kids don't have vaccine over there. And yeah, I mentioned about the rash, but maybe you and we talking about the skin condition this time, but maybe you just too worry about the father's pressure you to have the kids, so that's why you don't have time to investigate more about that. Yeah, so and again, it's not the reason for to diagnose condition over here, but I will try to see if you can guess what he has. Any list of differential diagnosis come to your mind at this time? What could be the kids with high fever, with some rash, with running nose, teary eyes, and no vaccinations? I heard someone say in the back. Yeah, yeah, you're right. I try to picture the case of measles, but yeah, but then also when you come up with some diagnosis, like always we have other differential diagnosis also. Yeah, it's yeah, could be contagious. I don't know whether this is AIDS, have meningococcus, things like that or not. But yeah, but what I will try to picture is measles. Okay, any feedback from Sarah, from Dr. Trung? Oh, seems like they.
Well,
Okay.
I'm here and I try to follow some of the conversation that I get lost. So I was not able to comment the very last part. But I completely agree with Dr. Doe on Pecan. So this is from now on to the rest of the class today. You guys, whoever sit in the back, try to participate. And if you see that your classmate struggling, like Dr. Min, you know, he's yelling at he need help, you can raise your hand and come up here help your colleague, because this is a team effort. And we spend like almost an hour now, actually more than an hour. This is a weekend, and I like you to come here and use your time wisely. I don't want you to come here and check your phone, and I don't want you to come here to just have fun. This is your time to talk, to improve your English. Okay, so maximize this opportunity by any chance. Just raise your hand and say, hey, she said something wrong. Just say that and say, hey, you know, this is the difference of diagnosis. This is, I think this is what it should be. Yeah, just say that. Okay, and then you can say, you can talk to Dr. Mendel, like, you're not a good father. Just say that. Okay, and he completely fine with that. So my point is talk. Okay, talk, and that's the only way that you can improve. All right, keep going.
Okay, maybe we need someone from the back then.
Yes, someone from the back. Never talk,
Yeah.
but never speak. All right. So I guess it's my turn now. So this time I will give you a different scenario. I think you may see this in the past, but I'd like to tell you this. So I'm a 56 years old female with breast cancer. I have chemotherapy. I have metastasis to my lung and my liver, and also some of my brain. I'm present to you as a doctor because I have a rash on my chest and also on the area that the lung radiation was a couple weeks ago. Okay, go ahead, doctor.
Hello, nice to meet you.
Doctor, very nice to meet you.
I'm Dr. Chang. How can I help you today?
You know, I don't know. I have something on my skin now after the treatment.
Mm, what? Can you repeat for me?
I think there's some rash in my skin after the treatments.
Yeah.
And I don't know why, because they removed my breast already. So my chest here become red, it's inflamed, and it's very itchy too.
Okay. When did it start? How long have this start?
Well, it's let's see, just maybe a week ago when I finished my therapy.
And where it started? Where did it start first?
Well, it started just here, and then it's just around this area.
On the upper trunk.
Yeah, it's on my chest, not the trunk. Trunk is
Okay.
the back.
Yeah, yeah. And you has rest skin on chest after treatment with with 1 week ago, right?
Yes, yes.
And you see me, you got to see me, and I'm here to will help you. I'm here to help you. Um, please ask me, please answer my questions. Um, can you describe your rust on the chest?
Okay. It is red in color. I can
Red.
feel it. It's palpable. I can feel it, and
Yes.
sometimes it's itchy, but also very painful.
Painful. And have any pain or abnormal sensations?
Pain? Yes, I say pain here, and then also very painful. Yes.
Yes. Did you use medication before? Have you ever used medication before?
No, I use too many medication, but no, nothing for the rash.
What disease you treatment before?
I have breast cancer.
Breast cancer.
Yeah.
Okay. And what much is better?
Nothing makes it better.
It's getting worse.
Yes.
Yes. Okay. Do you have fever?
No, I don't have fever.
Mm, have you had the rash before?
Have I what? Doctor, can you repeat your question? I'm not quite sure I understand.
Have you had the rash before?
Oh, did I have the rash before?
Okay.
Right? No, this is the first time. No.
This is the first time.
Yeah.
And mm, uh, do you use a moisturizing cream to apply your skin?
Well, I try a little bit, but I think it's just getting worse. Not much.
And in your family, the member in your family has the same symptom?
No, I'm the only one. You know, I that's you know what, doctor? One person had cancer is enough. I don't want all the family member has cancer.
Okay, I think so. Now I will exam for you. I don't have I will introduce you to Miss Doctor, another doctor. I can treat for you.
Sure. All right. So time's up. So you can pick anyone and keep going. Okay. Come up here. Keep going. Actually, I like somebody from the back. You know, who never talk to us or who never come to us. Come up here and talk.
Hello. I will start. Continue.
Okay.
Yeah.
All right. So what you like to know more about my rash, doctor?
Nhưng mà chị nói lại từ đầu luôn. Nói tiếp đi. Now, do you feel? I see you, Malaysia, not well.
Oh, do I feel fatigue or what? Not being well, not feeling well? Yes, I don't feel well. I do not feel well. No.
After your treatment cancer, you you appear this rough.
Yes. So after the cancer treatments, the rashes appear. I did not have this problem before. No.
Have you ever chicken pox before?
Oh, chicken pox. I think I have chicken pox when I was a kid. Yes.
Yeah. And now, are there anything else you have at same time? Fever or runny nose, diarrhea?
No, it just a rash on my chest, and no runny nose. But I think I have some diarrhea after the radiations, but it's improved now.
And do anything makes the rap better?
No, I don't think so.
Do you use some medication to reduce painful?
Yes. So I bought some hydrocortisone, 1% over the counter to help with my rash, but it's still there. It's not really improved.
Yeah. And in your family, the in your family who has the raps similar to your?
No, I'm the only one.
Only you. And, after your treatment of cancer, I think you can be deficient immunization, and you can be affected with all the virus or infection. I think you has zona zona zona. Do you know zona?
No, what is that?
This is a virus infection, and
Okay.
that you have a rat with itchy and painful, very
Yes.
painful. Yes, and now I will use some medication to reduce your painful.
Okay. What medication are you going to use?
Um, vi- uh, Aciclovir.
Okay.
And, and what? Any question?
Yeah. So my question is will it go away, or I will have that for the rest of my life because it's very painful. You know, I have cancer already. I hate to have all the condition, but this is really fire. It's really painful. Every time I take a deep breath or I move my chest, it's really painful. So my question is, will it be like this? How long it will be? How
I
long it's gonna last?
I have a scale from 1 to 10, and 1 is not painful, and 10 is very painful. Can you tell me how your scale?
It's I would say 9 or 10. It's very painful.
9, 9.
Yes.
Um, you very worried for this problem.
Yes. All right, that time's up. Let's move on to why don't you pick someone else and comment about your performance? Okay, pick anyone from the back and ask him or her think about how are you doing and what you can improve. Yes.
Yes, I think she asked you some question, and it's total.
Okay, so let me ask both of you and let me ask the entire class. So what is her main concern right now? What is her main concern?
I'm concerned about skin injuries.
Yes.
She follow the radiotherapy.
Yes. However, she have a very major medical problems, right?
Yeah.
What did she have? She have a terminal cancer. She have cancer that metastasis to multiple organs, right? So what I try to go to is, yes, you ask about the rash, but I would like you to ask more about her condition. Like, just ask about when the cancer was diagnosed. What is your understanding about your cancer? What is your worry? So I like you to see a global picture. It's not just a rat, because people come to see you for one problem, but I think this is the communication. It's coming, because if you ask more, you focus more, then you ask about her conditions, about her cancer, what's she worry, what's her goal, then I think that could be a better communication rather than just focus on the rash and the treatment. Does it make sense? So I think that's my comment for both of you, and I think for an entire class is whatever you come and you see a patient, it's yes, they may come with one problem and that's their concern, but your job is, I think our job as a physician, try to see what is the global picture is, right? You don't have to know a lot about cancer, you don't have to be an oncologist, but at least ask her, you know, when was the diagnosis and how you feel right now, you know, and does this rash impact to your quality of life, right? Because that's the thing is her quality of life. She concerning about her time. She did not probably will not have a lot of time left with her family, whatever. She want a healthy. She want something that she can spend time with her kids or whatever. And the rash, the painful rash, will slow and stop her from those activities. So your job is to ask more. All right. So as I say, in this class, we're not going to make a lot of diagnosis, but we focus on you, on how you talk to your patients, how you raise your voice, lower your voice, and kind of give you some, for example, I would say a lot, the first time when somebody told you about cancer, you can either, you can say something, I'm sorry to hear that, or you can say, well, can you tell me more about that? Something that you really like to know. Okay, don't jump into the rush already, because at that point, yes, that's the main concern. But if you ask for more, then I think she would approve you. Any comments, Dr. Raul or Sarah?
Sarah, go ahead.
So I think all of you are like are not really used to how to like approach like a depressed patient, because like the way you approach them, it just feel to me like you doesn't really care about their emotion. So try to show some compassion to them. They have terminal cancer. They are in really like terrible pain, and you just asking about a rash. So like her concern is not really about a rash. Her concern right now is about the pain. It's like 9 out of 10 is serious. So like you can actually like offer like, okay, so let me ask some question, and then we try to do something for your pain, something like that. So we help the patient like feel a little bit better before you can like get more information from her. So, and the first one is the the first speaker is a little bit you need to improve your English a little bit more to be able to communicate better. I think you need to like practice a little bit more. Yeah.
All right.
Okay. Just one little thing. Yeah, maybe I just have little comments over here. So we here to practice English, but just like the title of our group is like social skill or soft skill also. So yeah, just try to think a little bit more than just English. I know that you are still practicing at this, and you still haven't mastered the English skill, the English part yet. So you just to focus on the English part, and normally it's like that. If we too much focus on one area, we forget the whole picture. Like you can see the tree, but we cannot see the forest. Yeah, so with more practice, when you're more comfortable with English, then yeah, definitely you will take a step back and look at the whole picture. The second thing is, which maybe I have a little bit more privilege than Sarah and Dr. Trung, that I did have some time, 5-year practice in Vietnam. So I know your pressure, seeing patients every day, 20, 30, 40, 50, 60 patients a day, and you just try to get through, focus on the condition, focus on what you can treat, and move on. It's become part of our habit. So it's maybe a bit difficult for you to slow things down and look at pictures, look at patient as a whole. So I don't know which is the best way for you to apply what you are using here or what you are learning here on daily practice, because if we do everything we do over here, you may see like 10 patients a day, and then that's it. So yeah, you got to figure some way to maybe a little bit on some patients practice what you are doing over here in Vietnamese, so that you can slowly get it to become part of your practice. Yeah, that particular part, I still don't know how you may incorporate into your daily practice yet, but try, maybe sit down with the group later on and try to figure out. I don't want you to come here and study some skill set, and when you go home and go to hospital and practice totally different skill set, and then yeah, it's not it's very difficult for you. But I understand the situation in Vietnam is not easy. But keep practicing. At least try to improve on your English, and you have the time, and you can focus on the other part of medical care. Okay.
Thank you. Good job. And who's the next one? And let's do one more case, because I think our time is running out. But as I said, if you, for those who, how many of you have not talked at all? Just raise your hand. How many?
Five people.
5 people. Okay. Why don't we do a group interview? 5 you come up here. No, that's just for fun. You know, this is like communication. This is talking. So come up here. 5. Just come up here and let's sit together.
Just make it like a game, huh?
Yeah.
One keep asking question, and those who run out of question first gonna have to pay like
Yeah.
10,000 dong. The last man standing.
Yeah. All right. First of all, rule number 1: don't look down. Don't look on your notebook. Don't look at. Okay. Just leave everything behind. Just look at me or Dr. Doe or Sarah. Okay. Rule number 2: everyone must talk. If you don't say anything, I don't let you go home. Okay, that is simple like that. Okay, and if you say something, you have to say at least 1 minute. You cannot just say hello and then bye bye. No, you have to say something meaningful. Okay, meaningful and make sense. Okay, not only meaningful but also make sense. Okay, are we ready? All right. So this is 5 doctor, and I'm going to do this. So we interview you for a job. Okay, and so let me ask each of you, and let you go around and tell us. So we have a patient here that he's 75 years old. He have a rash in his lower extremity, his leg, and he's not able to move, and he's basically bedbound. So what is your first question? Let's go from left to right. A very old gentleman have a rash, and this guy has some other chronic problem that he cannot move, not mobile. He just sit on legs. Yeah, like that. First question, left to right. Go ahead.
Hi, I'm a pediatrician. Nice to meet you. And
Oh, wait. You are a pediatrician and you see a 75 years old.
no, I hear the boy, 5 years old boy. Sorry.
No, that's okay. See, so in this case, what you can say is, well, you're right. This is not my specialty, but because right now we don't have any doctor. All of us are pediatricians, so we're not trying our best to help you. But once we have more doctor come, we refer you to see a geriatrician like Dr. Doe or something that someone is special in this. Okay, so your first question is, how long the rash is?
When did you have this rash?
When do I have a rash? I have just for that past 2 days.
2 days. And tell me, where did it start?
Well, that's a good question. It started on my thigh, and then now on my leg, on the side, on the anterior portion of my leg, on the tibia surface. There's rash right there, both of them.
What are the places is affected?
Oh, the place affected? Okay. So here it's both legs on the anterior surface, on the tibia surface. There's some of them on the medial side, but lateral medial somehow was also affected, but the anterior surface is more affected. Next one. Okay.
When did it start?
When? Okay. So this is rule number 2. You cannot ask someone else question already. Okay. So somebody asked this question already. Ask something else.
It's itchy.
Oh, great question. No, it's not itchy. No, it's not itchy.
It is painful.
Painful? No, it's not painful.
Do you feel any abnormal sensation?
Oh, okay. Well, sometimes I feel a little bit numbness, tingling on my leg. Yes, some change in my sensation. Okay, so how about the gentleman doctor?
What made the
rash go away?
Wow, I don't know. If I know, I'm not going to see you, right? It's still here.
Have you ever used some drugs?
What? Using what?
Have you ever used some medicine?
Have I ever used some medications, some medicine?
Yes.
Okay. I don't know. I haven't used anything. I just feel like I have so many problems going on right now. So I just don't want to bother with the rash.
Do you have a fever?
Yes, I have fever.
What makes the rash worse?
What makes the rash worse? I remember actually when it started, it's not that bad, but for the past 2 days, it's getting worse. I don't know what makes it worse, but it sounds like it's getting worse every day.
Yes. Do you have you ever allergic to some food or some medicine? Have you ever allergic to some allergy?
Good question. Have I have any allergies, right, to medicine? Okay. Or any drug reaction, right? Drug interaction. No, I don't have any history of allergies. No.
Has the rash changed over time?
Good question. No, it's always there.
Ông này bị liệt rồi. You cannot move. Đau quá. Không, hỏi ông có đi. Your is affects your daily activities.
It's what?
The rest affects your daily activities.
Okay. No, not much. But just want to show you how my rash look like. Okay.
Yeah.
All right. You see it?
Diabetes is so bad.
Okay.
And,
All right.
Do you have any other problem like diabetes?
No diabetes.
Diabetes.
All right, so I know that that's one gentleman. He did not, who had not have any question so far.
Hỏi đây không? Hỏi một câu bất kỳ luôn. Hỏi đi con. Những câu hỏi thế em nói.
Come on, just.
Hỏi bị bệnh nội khoa không? Thực sự gia đình con.
What it made better?
What?
What it make it better?
What make it better? I don't know. It's just getting worse every day. I don't think it's getting better now.
Thay đổi xà phòng không?
This it presenting or just come and go?
Good question. It's not come and go. It's been there all the time. All right, so let's stop right there. So can anyone summarize what you have known so far about this patient?
You are now man 25 years old. And,
Okay.
You have a rash on leg. And
Okay.
you can move. It's itchy, it's pain, and you have fever.
Mm-hmm.
It's constantly and it's constantly out time, and you can reduce this rash with anything. You know alcoholic history, and you know have a diabetes. diabetes and
Không có tiền sử dụng nè.
as you know, allergic history and
No allergy history, no.
the
And I have rashes both of my legs, okay, not just one side, both sides, left and right.
Cellulitis. Is it cellulitis?
What is cellulitis?
It's the inflammation of the skin. It's maybe caused by the bacteria.
Okay. Well, I don't think so actually. So how about keep going? Okay, let's focus on the OCAR question. Now we talk about onset, location, associated symptom. You ask about relieving factor. You ask about temporal timing, like when it started and relationship with that. You also ask about character. It's itchy, no itchy, painful, kind of plus or minus, but not itchy. It's always all the time. So those are good questions. Now you need to move to a higher level, okay? Because OCARs we started, but now we move forward. One thing that 75 years old gentleman, you want to ask about what are his medical problem, right? You ask about diabetes. So what else you're gonna ask?
Do you have a high blood pressure?
Okay. Oh no, high blood pressure.
Any heart disease? Do you have any heart disease?
Oh, any heart disease, any cardiovascular heart disease? Yes, I do have. I have some coronary artery disease.
Yes. So you use the anticoagulator medicine or not?
Oh, I see. You mean anticoagulation, right? And anticoagulants. Yes, I'm taking aspirin and Plavix.
So how long have you used this medicine?
It's almost a year. I mean, last year I have a heart attack, so they put a stent, and now I'm taking those two medications.
And do you have any bleeding in your body or not?
No, no bleeding. All right, so let's time right here. So we asked about medical problem, right? Condition, right? One thing about this is if somebody present with a symmetric rash, we talked about this in the past, right? You more concerned about systemic disease, and this guy have fever. So then we should ask more about or fatigue or any abdominal pain, diarrhea, anything that's more systemic. It sounds like multi-system here. So we can ask about that. But I'd like to tell you, this is a tricky question because for an older patient, and most of you, fortunately, won't see it. But no matter what, when you see a patient, asking questions like an art, keep asking and thinking like a bigger picture, why he's here and why he had this rash. All right, so to actually, if you look at the picture I sent you, it says vasculitis on the picture. I just realized that. If you look at that very quick, it says vasculitis. So the gentleman has vasculitis. It's a type of systemic disease that usually it comes in people that have hepatitis C. In this case, he does have hepatitis C. I also have CAD. What I like to finish in the last maybe 5-10 minutes to finish the class is I'd like you to tell me what we should do. Because if I'm speaking too fast, or Dr. Doe or Sarah, or we have gap in our class or our group, we need to adjust. We are here to help you. So tell us what we should do. Okay? You can speak Vietnamese, that's fine.
Tụi em có thấy ổn không? I think that's về tốc độ nói như vậy cũng được thầy hay nào? Còn lại về các em có ý kiến đi. cái ngôn ngữ hoặc là 4 từ hoặc cái gì đó em gặp khó khăn không? Chị nghĩ là nên nói từ các bạn nếu các bạn có không thể một cá nhân nói được, mỗi em nói quan hệ cái speak around. Chị thấy rất
Dạ đúng rồi đó chị, cứ mỗi bạn cho cái ý kiến cá nhân của mình về cái sức học của mình, về cái khả năng theo cái lớp này.
Có một vài từ chuyên ngành mà tụi em nghe không rõ thì sẽ nhờ nhóm đánh vào trong hộp chat luôn để cho tụi em
Ok, em nói đi, anh nghĩ Sarah sẽ đánh ra được, sẽ giúp em nói được.
mỗi người cứ nói cái ý kiến của mình đi cho nó dễ. Hân nói cho em. Tại vì thầy muốn biết cả lớp mà, cho nên chị không thể đại diện cho một ý được. Các em nói, mỗi em cũng nên nói trong cái vấn đề của mình. Thì nó to đi, thì nó to đi thầy. Ly.
Em là cái giao tiếp với bệnh nhân á, nhiều lúc là cái tình huống đó bọn em biết là phải nên ví dụ bày tỏ cái sự tiếc nuối khi em nghe bệnh nhân bị ung thư, nhưng mà không biết trong tiếng Anh thì mình nên dùng cái từ đó. Nói chung là về cái ngôn ngữ giao tiếp hàng ngày mà em chưa có biết.
Ví dụ như em nói là khi bệnh nhân bị ung thư em thấy tiếc hay là sao?
Em thấy buồn vì nghe thì cái điều đó, nhưng mà
cái câu mà mình muốn nói
okay.
biết diễn đạt
cái câu nói á thật sự không quan trọng nhiều bằng cái lời nói. Cái câu nói không có quan trọng bằng cái thái độ và ánh mắt. Thành ra khi mà tụi em nói là ok I'm sorry to hear that, em phải nhìn vào mắt người ta và thật sự có nghĩa như vậy. Cũng giống như khi mà mình thương ai á, là mình nhìn vào mắt người ta mình nói ok, chứ đừng có nói là giống như là I'm sorry to hear that. They're gonna nobody will like you. Okay, so cái point của anh là tụi em có thể nói cái gì cũng được, nhưng mà look, try to think. Okay, all you need just say I'm sorry to hear that. It's very simple like that. It can make a difference. Okay, and cái ngữ cảnh á, cũng giống như khi mà nói chuyện bệnh nhân. Thật sự là khi mà anh làm cái khóa này, có một số bạn bác sĩ Linh Phan bên câu lạc bộ quản lý chất lượng thì có nói là muốn đề nghị cùng với VietMD mở hẳn một cái lớp để dạy về, không phải dạy mà nói về kỹ năng giao tiếp luôn. Tại vì đó là một trong kỹ năng mà không biết là tụi em như thế nào, nhưng bác sĩ Linh Phan nói là một trong kỹ năng mà hầu như không được dạy, gọi là kỹ năng mềm á, mà không chỉ riêng tiếng Việt lẫn tiếng Anh nữa. Thành ra bây giờ bắt mọi người nói kỹ năng mềm mà tiếng Anh, có nghĩa là kỹ năng tiếng Việt mình nhiều khi mình bận quá, mình không có thời gian mình làm, bây giờ mình nhảy qua tiếng Anh đó thì nó hơi bất công so với nhóm. Thành ra anh muốn dành cái thời gian còn lại để nói, tụi em có thể nói tiếng Việt cũng được, nhưng mà cái ngôn ngữ giao tiếp rất là quan trọng. Và trong cái khóa học này của mình đó, chủ yếu một cái ngôn ngữ nói thôi, đó là tiếng Anh nhưng mà sẽ có dịp mình nói tiếng Việt trong đó.
Ví dụ như mẹ của Sarah mà lúc mà lo lắng đó thì mình nên nói gì anh? Cái lúc mà người mẹ như Sarah lo lắng đó, thì mình làm sao để calm down?
Yeah. Trong trường hợp đó cái cách em nói chuyện rất là quan trọng. Em chỉ phải nói chậm thôi. Anh có gặp nhiều bệnh nhân rất là crazy cho nó, anh chỉ nhìn cho nó everything will be fine. Thấy không? Nói chậm lại. Cái cách mình nói á, nó quan trọng lắm chứ. No, okay, you're gonna be okay, don't worry. Cách em nói như vậy là oh my god, it drives people nuts. Okay, so just listen, wait. Cái khi mà họ vừa nói xong đó, mình nhảy vô và nói là I understand. Hoặc là em chỉ nói một vài câu vậy thôi, nhưng mà nó sẽ cho người ta được calm lại cái đó. Và đó là những cái mà mình tiếp xúc, mình hướng dẫn như vậy. Ok.
Tụi em nói cái vấn đề của tụi em trong lớp học này có gì nói? Em hỏi đi. Em không có việc cái này. Em nói đi, em nói không thanh bọn em mà.
Ý là ví dụ khi mà mình muốn xin hỏi ý kiến của ba mẹ bệnh nhân, mình muốn truyền máu cho em đó thì mình giải thích như thế nào để cho
Hình như cái bài đó bài 4 của thầy có. Như trong một bài hỏi là bạn muốn hỏi là nếu như mình muốn làm xét nghiệm cho bệnh nhân thì mình nên nói cái câu gì á?
Em hỏi lại cho anh cái anh mới trả lời cái email. Em hỏi lại cái như thế nào?
Ý giống như là lúc mà Dương định làm xét nghiệm mất cho cái ca của anh Minh đó, là muốn lấy máu rồi đó, thì mình nên nói những cái câu như thế nào để mà mình để làm xét nghiệm cho bệnh nhân đó? lấy máu của con họ.
Bây giờ anh Minh, anh nhắc lại cái câu lúc mà em không nghe rồi. Anh Minh sẽ lấy máu của con anh Minh.
No, it's just like I guess any parents have concern. Ai cũng, nhất là con nhỏ mà lấy máu thường cũng đâu có dễ đúng không? Chị nào giỏi tay nghề lắm thì lấy tốt, có không thì cũng đâm tới đâm lui mấy lần thì bố mẹ nào cũng sót con. Thì yeah, I think that's chắc là cũng như mấy chị nói ở bên nhà thôi, thì cũng ráng động viên an ủi. Yeah, I try my best, so I have the best technicians to do it. But also warn them in advance that the kids is small. It's going to be difficult, but it's for the benefit of the kids. We need to find out the problems so that we can treat the kids properly. Thường bên đây đôi khi gì đó bên nói thiệt, chứ cũng có khi phải nói quá lên chút xíu nữa, chứ nói là không có đau đâu, làm 10 giây 30 giây là xong rồi mình làm hì hục 5 phút chưa xong là người ta đâu có chịu, đúng không? Thì hồi đó thì hồi học về bên khớp, có ông thầy dạy chích thuốc vào trong khớp đó, thì ông cũng nói chích cái này thì tôi cũng làm nhiều rồi, thì cái kỹ thuật này thì chích xong thì sẽ đỡ đau, nhưng mà nó khó lắm. Nhiều người thì đau lắm nhưng mà ráng, nhưng mà chích xong thì nói ủa không có đau hết hả? Khen bác sĩ giỏi quá, cái này khó vậy mà bác sĩ làm cũng được. Không phải nói không phải nói xạo đâu, chỉ nói hơi quá lên chút xíu thôi. Hoặc là nói cái best worst scenario thôi, tại vì mình đâu có biết được là nó ra làm sao, đúng không? Thì nhưng mà mình nói là cái này mình cần, nên mình cố gắng làm tốt nhất có thể, rồi nó cũng giải thích là tại sao mình phải làm như vậy, chứ nói lấy máu đi rồi xong rồi nói bệnh nhân phản ánh lên rồi nói tại sao lấy máu, nói thôi vậy thì khỏi, không lấy máu thì cũng không được, đúng không? Tại vì như vậy thì cái lý do lấy máu ban đầu của mình nó không cần thiết hay là sao thì cũng không phải. Thì phải có cái quyết định, mình cũng phải có cái confidence của mình.
Rồi, mọi người có câu hỏi nào nữa không trước khi mình chuẩn bị kết thúc lớp ngày hôm nay đây? Tuần sau anh sẽ nói mình sẽ nói tí xíu về tư vấn dinh dưỡng tâm niệm. Okay, sure.
Sau khi mình khám và mình biết là bệnh nhân là tình trạng bệnh nhân là rất nặng, thì mình giải thích hay là nói sao để cho người nhà đứa bé là không cảm thấy là lo lắng hay là cảm thấy là thiệt hại cả. Chứ mình giải thích và như thế nào để cho họ hiểu cái tình trạng của bệnh nhân mà người nhà không cảm thấy là buồn rầu hay là sốc kia.
Như mình sau khi khám xong mình nói ha, để người nhà họ không có cảm thấy lo lắng về tình trạng của bệnh nhân buồn rầu đó hả? Anh nghĩ câu này là một câu hỏi khó, tại vì nhất là cha mẹ. Xin mà nói cái câu nói này, mình bữa nay mình có bác sĩ Nhi vô ha anh Minh ha, bác sĩ Như chứ, bác sĩ Như là bác sĩ cũng Nhi bên đây nè, thì đây là những cái situation. Kinh nghiệm cá nhân của mình là thật sự câu này rất là khó trả lời, tại vì cái đầu tiên nhất là mà cha mẹ mang con tới phòng khám, cái này kinh nghiệm của mình khi làm urgent care thôi, mình online làm urgent care ngoài, thì cái thắc mắc của họ nếu mà không có được giải đáp thì là mình cố gắng mình giải thích hết tất cả những cái gì mà họ nói, mà thời gian này cũng không nhiều, chỉ có 15 phút một người thôi, nhưng mà thông thường đó là mình giải thích hết những cái thắc mắc của họ. Nhiều khi họ mang con họ tới vì một cái chuyện rất là đơn giản là bị ho thôi, nhưng mà họ hỏi thêm những chuyện khác nữa, như họ hỏi về chích vaccine, chích về những cái khác, và trong những trường hợp đó là mình trả lời hết, tại nếu mà mình trả lời không hết là mình biết là khi mà họ rời khỏi phòng khám thì họ lại không có an tâm. Như here. Oh my gosh. Let me ask chị Như vào. Ok. Rồi có chị Như rồi, để chị Như trả lời.
Mới vô là bị đánh phủ đầu liền. Hi Như.
Okay. Right.
Has some question for you.
Yes, some question.
Rồi.
Yes. Rồi. Rồi em hỏi lại đi chị Như, là bác sĩ Nhi đây.
Có nghe hỏi là muốn nói chuyện như thế nào với lại ba mẹ bệnh nhân, thì xin hỏi lại cho nó rõ đi, tại vì nghe được một phút thôi à.
Dạ, thì sau khi mình khám cho bệnh đứa trẻ thì mình biết rằng tình trạng của trẻ là rất là nặng, thì mình sẽ giải thích sao với bố mẹ đứa trẻ là cái tình trạng của đứa trẻ để làm sao mà bố mẹ của đứa trẻ là không cảm thấy lo lắng hay là sợ hãi về tình trạng của đứa trẻ. Mình giải thích sao với người nhà của bệnh nhân?
Cái tình trạng nặng là tiên lượng xấu hay là như thế nào?
Tiên lượng xấu của
cái tiền lượng xấu thì thật ra thì vẫn phải nói, nhưng mà giống như mình nói là ok, mình giải thích theo Như thì là giải thích ngay từ đầu là cái tình trạng của bệnh nhân có những cái dấu hiệu như vậy là thành ra là cái chẩn đoán nó sẽ là cái chẩn đoán nào đó, rồi cái chẩn đoán đó thì nó vì những cái dấu hiệu như thế nào thì nó sẽ có cái tiên lượng nó không có phải là thuận lợi, và với cái tiên lượng như vậy á thì mình sẽ xử trí như thế nào, mình sẽ đưa ra cho họ cho bệnh nhân những cái plan, mà những cái kế hoạch mà mình có thể mình làm được. Và mình cũng nói thiệt là với như vậy á thì là mình có bao nhiêu % là mình hy vọng là nó qua, hay là nó có cái gì mà mình thấy là nó sẽ không có thuận lợi cho đứa bé thì mình cũng vẫn phải nói. Thực sự thì khi mà mình nói như vậy họ chuẩn bị cái tinh thần nó tốt hơn là mình không nói, theo Như là như vậy. Nhưng mà thí dụ như giống như là mình không có dọa, mình không có nói giống như là dọa hơn, mình sẽ nói hơi xuống chút xíu để cho họ không có sợ quá, nhưng mà họ cũng không có muốn họ không có sợ quá để mà họ lơ là cho con họ. Thành ra là với nói là tôi sẽ update, giống như tôi sẽ nói cho bạn biết là sau như là nếu mà có gì mới thì sẽ nói thêm, rồi có câu hỏi gì không, cuối cùng lúc nào mình cũng kết thúc là bạn có câu hỏi gì tôi không, và nếu mà có câu hỏi gì ấy, thì đây là cái cách để liên lạc với tôi, như giờ bằng qua y tá hay là qua cái email hay là gọi vô phòng khám hay gì thì xin gọi lại, tôi sẽ gọi lại cho bạn và tôi sẽ giải thích cho bạn thêm. Thì lúc nào Như cũng sẽ nói như vậy. Nhưng mà trong cái phòng khám clinic của Như thì thường thì nó cũng không có bị những cái trường hợp nặng nhiều, chỉ có lúc mà đi residency này nọ thì với lại lúc mà training thì lúc nào mình cũng được training về mấy cái đó.
Chị Như nói cái đoạn đó bằng tiếng Anh giùm em á, cái đoạn những cái câu
Yeah, so let's say you have to counseling parents with a child with like severe meningococcus or something like that, like just
like
pick
meningitis.
Yeah, meningitis, something like that severe.
Okay, so if we have a kid with meningitis and for example have very severe infection and affect the consciousness already, so we need to tell the parent that hello, giới thiệu to my name is somebody here, my name is that, I am the doctor taking care of your patient, your kid. I would like to talk with you about how your kid doing today. So from the time that your kid coming into our care, that this is all the symptoms that your kid has. For example, fever, headache, and we do at this certain lab, we do the lab puncture, we do blood test, blood culture, everything showing that your kid having a certain infection by bacteria, naming meningococcus. So this is very pretty severe infection that require a very good care, antibiotics for quite a long time, and we will have certain condition that we need to monitor on your kid, such as how they will come out of the coma, or how the vital signs will be, how the fever. With that, we will update you every day. For right now, the plan will be we should continue on the medication, including this and this. Is if the kid on the machine or something like that, we will need to monitor on those certain vital signs, and then we will update you every day. And you have any question, you can feel free to call me back anytime, or call the nurse, and they know how to get me in contact with you. For right now, do you have any question for me? Something like that. Tôi có thiếu gì không?
Thì thì cũng khá là chi tiết. Thì thường nó có hai cái tình huống. Một là cái tình huống rất là cấp cứu, như đứa bé ví dụ bị đụng xe đang vô bệnh viện, tình trạng rất là nặng rồi, thì nó hơi khác. Một cái là đứa bé nằm ICU mấy bữa rồi nó không có tiến lượng tốt, rồi nó trở nặng. Thì hai cái tình huống nó hơi khác nhau chút xíu. Nhưng mà cái quan trọng nhất là phải có làm sao build cái trust, làm sao cho người ta tin tưởng mình. Thì cái mà mình phải làm là cái communication, cái mà cung cấp thông tin liên tục, cập nhật cho người bệnh. Với người bệnh nhân lớn, hồi trong residency có một cái buổi làm sao để thông báo tin xấu cho bệnh nhân, cho người nhà đó. Ví dụ người nhà nằm ICU 2 tuần rồi, có vẻ chết não rồi, giờ bàn tới chuyện rút ống thở chẳng hạn. Đó thì sẽ cái setting cái buổi ra làm sao cho vô cái phòng không có quá sáng, không quá tối, rồi có tất cả người nhà ở trong đó, để khỏi phải nói cho một người rồi xong người khác tới hỏi mình nữa, người khác tới nói mình nữa, thì cũng không nên. Rồi cũng khi đó là ai mà trong cái team điều trị mà thì cũng nên có mặt để mình biết được là mọi người đều có quan tâm tới. Rồi mình cũng sẽ hỏi là thường câu hỏi đầu tiên là mình sẽ hỏi là tới thời điểm này nè, thì người nhà biết cái tình trạng bệnh nhân ra làm sao rồi đó. Thì nhiều khi người ta biết rõ lắm, nhiều khi người ta biết là không có qua khỏi rồi đó, thì người ta nói cho mình thì mình cũng dễ dàng hơn, với là mình biết được cái mức độ hiểu của người ta tới mức nào, cái tình trạng của bệnh nhân tới mức nào đó, thì mình sẽ dựa trên đó mình nói cho rõ ràng hơn, thì nó cũng đơn giản hơn. Chứ không là có khi người nhà nghĩ là bệnh nhân sắp qua khỏi rồi, sắp ra khỏi ICU rồi, mà đụng cái mình nói bệnh nhân sắp chết rồi, mình sắp rút ống rồi, thì đúng là người ta cũng sốc. Nhưng mà có cũng có nghĩa là mình communicate trước đó dở quá, người ta không biết chuyện gì đang xảy ra. Đó, nhưng mà nó có những cái step đó, thì rồi cũng như vậy, trả lời mọi câu hỏi có thể cho bệnh nhân, cho người nhà. Rồi cũng như bác sĩ Như nói đó, luôn luôn có phần để bệnh nhân có câu hỏi gì hay không thì mình phải trả lời cho trọn vẹn. Thì một cái case như vậy thì khá là dài. Chắc bữa nào nếu muốn chắc phải làm riêng một cái buổi để trình bày những cái dạng câu mà để nói. Nhưng mà như là bác sĩ Bình nói hồi nãy đó, thì cái show cái compassion, show that mình care, nhìn vô bệnh nhân chứ không phải là nhìn cho điện thoại rồi nói hay bệnh này nặng lắm, tôi rất là lo, nhưng mà một mặt thì texting gì đó thì cũng không được. Đó, show that you really care, and just it's not very difficult to show that you care. Just maybe turn around from your computer, from your chat, from your phone, touch the patient, hold hand if need to, and says I'm really sorry. I know it's difficult for you. We try our best. We keep trying, and and we do the best we could for your child. Thì cách đó nó rất là quan trọng.
And make a good eye contact and make it slowly.
Okay. Như vậy thì các bạn còn có thêm câu hỏi nào trước khi chúng ta kết thúc buổi học ngày hôm nay không ạ? Như hy vọng lần sau chị có thể đến, tại vì có lẽ chị chia sẻ được nhiều câu thực tế hơn. Tuần sau chúng ta sẽ nói về tư vấn dinh dưỡng nha, tại vì đây là cái phần mà hầu như bác sĩ Nhiên cũng sẽ nói, nhất là cho các bạn nói về sữa mẹ với lại sữa bò. Cái đây là những chủ đề rất là nóng bỏng trên mạng gần đây, nhất là những ai mà anti sữa bò và những người nào cách chúng ta muốn nói đây là tập trước cho các bạn biết cái topic để học trước những từ đó, về dinh dưỡng, và tôi sẽ post một cái bài sơ về đó để các bạn đọc. Tại vì dinh dưỡng đặc biệt đối với khoa nhi thì rất là quan trọng, và may mắn là có chị Như ở đây nữa, thành ra đó là những cái mà các bạn sẽ cần phải nói và tập nói và tư vấn cho cha mẹ. Và các tình huống của chúng ta là nói trước cũng để cho các bạn chuẩn bị là những trường hợp những bé mà bị suy dinh dưỡng hoặc là nó béo phì, nói chung đó những cái trường hợp mà các bạn phải cho người ta thấy được cái sự cảm giác của mình trong đó, chứ không phải là giống như bác sĩ Minh mới nói là vừa bấm điện thoại vì nói là con bà mập quá giờ nó nhìn ăn đi, nói chung đó những cái câu đó không phải cái lớp. Ok, được không?
So homework?
Yes. So homework for next time, for next week, it's again you guys will pair together and we talk about nutrition. Okay, so the topic that I like you to discuss actually milk and supplements, and then I think it's milk and supplements, and then yes, multivitamins and food. You can pick any of those and you pair up, and one of them your parents, not your parents, the patient parents. So you are one of the doctor, and the situation that you will ask about milk or breast. The other thing is breastfeeding versus not breastfeeding. You can pick any of those, and you can talk about a favorite nutrition topic that you like to tell the kid should take it. The other thing that I saw commonly is premature puberty. So this is in industrial countries like girls about 7 or 8 years old, they about to become puberty, and due to other things. So those are controversial topics, but also give you some idea. So is that enough homework? So men is about nutrition, okay, nutrition and consultant, and you as a pediatrician will talk to parents a lot about those.
So we will play a role in nutrition program.
Yeah, so I say you pair up, okay, and this time I like you to pair up one really good English and one not so good English. Don't, because what I see in the past is you two, some of them are very good, and I like the bigger one help the smaller one, okay, and they pull together. So again, cái topic là các bạn chọn mình là cha hoặc là mẹ của đứa bé đó, và mình hỏi về cái dinh dưỡng của con của mình, có nên uống sữa hay không, có nên bú sữa mẹ hay bú sữa bình, mấy cái thực phẩm chức năng có nên cho con ăn không, nếu mình muốn con mình thông minh thì nên cho nó ăn cái gì. Đây là những câu hỏi rất là thông dụng mà bất kỳ cha mẹ nào cũng hay đến cái văn phòng của các bạn để hỏi. Và nói tí xíu nữa là về cái dậy thì sớm hơn chẳng hạn. Một số bé như là bé gái có thể có những cái dấu hiệu dậy thì sớm hơn cái tuổi của họ. Đây là những cái chủ đề rất là thông dụng mà tôi nghĩ các bạn nên làm quen và nói chuyện tiếng Anh. Tại vì không sớm thì muộn các bạn cũng sẽ gặp những bệnh nhân như vậy và họ nói chuyện tiếng Anh để các bạn hiểu.
Quay đó chứ? And you will do the video clip?
Yes, you do the. But again, if you can do a clip without echoes, so some of you do really good job, but not the echo one because the echo sometimes I could not. And then, yeah. And here's the thing. By the way, if you guys feel confident, actually you can post your video on the VietMD English Club, because this is a larger. We have about 3,000 members, so post your video there. People will comment. Okay, be ready. Okay, chuẩn bị ném đá, but that's okay. If you can defend yourself, that's okay. This is all about learning. Okay, don't care about people if they give negative comments. Okay, we good? All right. So let's I see you next week. Okay, and hopefully chị Như và anh Điên and Minh. Any question before we?
Thì thầy vẫn muốn là một bạn yếu là với một bạn khá là, nhưng mà làm một cái video thì người bạn yếu là làm giống bác sĩ hay là làm
Người bạn yếu là bác sĩ.
Người bạn yếu là bác sĩ.
Người bạn yếu phải nói nhiều hơn. Nó phải hiểu mình nói nhiều hơn. Ok. Okay. See you. Have a good night. Also have a good morning, everyone. Okay. See you.
Thank you so much.
See you next week. Bye.
Yeah. Bye bye chị Như. Bye bye anh Minh. Bye bye.
Bye. Yeah, bye.